Hello students, welcome to Angel Health Academy. Topic for the day or topic for the session is non-communicable disease problems in India. NCDs problems in India. NCD problems in India are the part of the major health problems in India. I have been already uploaded a video regarding major health problems. In that I have discussed 8 different problems such as communicable disease problems, non-communicable disease problems, nutritional problems, MCH maternal and child health problems, environmental sanitation problems, medical care problems, population problems and other problems. I have been also uploaded a video regarding communicable disease problems in India. So in this video I am going to discuss about the significance of non-communicable disease problems in India. India has a significant burden, rising burden of various non-communicable diseases, and the number of cases of NCDs have been rising over the past years. When comparing to communicable disease, we have a more significant burden about the non-communicable disease from the last few years. According to WHO report on non-communicable disease global survey, according to the universal or world survey, WHO has been given the report that is 1 in 4 Indians, 1 out of 4 person in India face the risk of death, chances of death from non-communicable diseases before the age of 70 or before 70 years. So according to WHO report on non-communicable disease global survey, it is said that 1 in 4 person in India having the risk of death from various non-communicable diseases before the age of 70 years. The major non-communicable diseases prevalent at present in India are hypertension, obesity, chronic kidney diseases, diabetes mellitus, chronic respiratory diseases, cardiovascular diseases, blindness, stroke, rheumatic heart diseases, cancer and accidents. So these are the important major communicable disease prevalent or present at present in India. Hypertension, obesity, chronic kidney diseases, diabetes mellitus, chronic respiratory diseases, for example COPD, then cardiovascular diseases, blindness, stroke, rheumatic heart diseases, cancers and even accident also considered as a non-communicable disease. So significance of any disease, or for example non-communicable disease problem can be understood by its morbidity rate, present cases, prevalent cases in India, and mortality rate, death rate due to that particular problem among the population in India, and some general features about the particular disease, that is how much they contribute to the world total burden of that particular problem. For that you have to understand some of the terminology like keys like L stands for lakh. You know better than me, that is the 100,000 comes in 1 lakh. Regarding million, I will be writing sometimes regarding million or billion. So 1 million is equal to 10 lakhs. 1 million is equal to 10 lakh and 1 billion is equal to 1000 million. So 1000 million comes in 1 billion and 10 lakhs comes in 1 million. Then 100,000 is the lakh. Please understand this, then you can understand better about the morbidity and mortality statistics of the various non-communicable diseases. I am going to explain in a tabular form. So this is the tabular form of major non-communicable diseases prevalent in India. I have written chronologically this status, so you can understand, remember the significance. So regarding morbidity data for the number of cases in India, I have been written in this row, and this is regarding mortality data and general features, how much they contribute to the world and other features I have been written in this third row. So first is hypertension. So India has nearly 200 million cases of hypertensive patients. So the morbidity rate of hypertension in India is at present is 200 million. The mortality rate, the death among the people in hypertension in India are 1.6 million death. So every year we are having 1.6 million death from hypertensive patients, and we have the total number of cases, that is 200 million. The general features include India contribute around 17% of the world hypertension cases. So India contributes 17% of the world hypertension cases. That is 1/6 of the world. 1/6 of the world India contribute. Okay. There are 1.2 billion cases in the world. Then second is regarding obesity. Okay. So India has obese people that is more than 135 million. Okay. So out of the total population in India, we have more than 135 million obesity cases. Okay. Then mortality or death among the various problems regarding mortality. Then death among the people of different problems with obesity is 2.8 million. Okay, so every year we have 2.8 million death among the obese people of 135 million cases. Okay, then obese people contribute approximately more than 6 to 7% of the world obesity cases. So India contribute approximately more than 6 to 7% of the world cases. In the world there are 2 billion cases of obese patients. So the world cases of obesity is 2 billion. Okay, there are 2 billion cases of obese patients in the world. Out of that, India contributed 6 to 7% of the world obese patients or obesity cases. Then third is chronic kidney diseases. So the morbidity rate in India or prevalent statistics in India is 120 to 130 million cases. So India has 120 to 130 million cases of chronic or patients suffering from chronic kidney diseases. The mortality rate of the people with chronic kidney disease in India is 1.7 million. That means 1.7 million people suffering from chronic kidney disease die every year in India. That is 1.7 million. Then India contribute nearly 20 to 25% of the world chronic kidney disease cases. Okay, in the world there are nearly 850 million cases. So thus India contribute nearly 20 to 25% of the world chronic kidney disease cases. Then regarding diabetes mellitus, the significance is the morbidity statistics or diabetes mellitus prevalent in India is 77 million cases. India has 77 million diabetic patients or cases. Okay. Then the death or mortality based on 2020 statistics, we have 7 lakh people dies every year with diabetes mellitus. So the mortality rate of diabetic patients is in India is 7 lakh. Okay, according to the 2020 statistics. Then India contributed the second most cases of diabetes in the world. Okay, so we are the second most cases of diabetes mellitus in the world. Okay, then regarding chronic respiratory diseases, CRDs. Okay, so India has nearly 55.23 million cases of chronic respiratory disease patients or cases. The morbidity statistics is 55.23 million. In that, most cases are belongs to COPD, chronic obstructive pulmonary diseases. Regarding mortality statistics, we have 0.85 million cases of death every year due to chronic respiratory diseases and COPDs. So regarding the mortality statistics, India contribute to, or India is the second largest country to have a COPD death, like 0.85 million per year. Okay. Thus, India contributes second largest death among the people in COPD. Okay. Then regarding cardiovascular diseases. Okay. So we have more than 50 million cases. Okay. India has more than 50 million cardiovascular disease patients. Okay. That is, when you take 1 lakh population in India, out of that 456.7 people are suffering from cardiovascular diseases in India. Okay. Regarding the mortality or death rate among the population of CVDs in India, that is 4.77 million according to the 2020 statistics. Okay. So every year we have more than 4.77 million death among the various cardiovascular disease patients. Then moreover, India contributed nearly 20% of the total cardiovascular disease cases. Okay, 20% of the total world cases. Okay, in the world we have around 523 million cases of cardiovascular disease patients. 523 million cases. Okay. The next is regarding blindness. Okay. So India has nearly 15 million blind people. Okay. So blindness morbidity status or prevalence in India is 15 million cases. Actually, there is no direct mortality from blindness. Thus, fortunately, there is no direct death among the blind people due to blindness. Okay. Then India contributes 1 out of 3 blind person in the world. That is 1:3 of the total blind people in the world. So next is regarding stroke. Okay. India has 13 to 15 million cases of stroke patients. Okay, so the prevalence or morbidity rate of stroke patients in India is 13 to 15 million cases. Okay, then the mortality rate according to 2017 statistics it was 1.8 lakh. That is 1,08,000 population were died or stroke patients were died in 2017. So according to 2017 statistics, 1,08,000 stroke patients died in India. That was 1.08 lakh. Then moreover, India contributed nearly or approximately more than 10% of the total world cases of stroke patients according to 2021 census and statistics. Then next major non-communicable disease is rheumatic heart diseases. India has nearly 13.2 million. Okay, 13.2 million cases of rheumatic heart disease patients. Okay, that is 13.2 million cases of RHDs. So rheumatic heart diseases in India is 13.2 million, and every year there are 192 people per lakh population dies from rheumatic heart diseases. Okay, so mortality rate is 192 per lakh of RHD patients. Moreover, India contributed nearly 40% of the total RHD cases in the world. So our contribution to the world is 40% of the total cases of heart diseases in the world. And other feature is 1 in 4, that is out of 4, everyone over 25 years in India are at risk of having rheumatic heart diseases. Okay, the people having risk in the national, that is 1 in 4 over 25 years risk of having rheumatic heart diseases. The next major non-communicable disease prevalent in India is cancer. Okay, so cancers, the morbidity statistics or number of people suffering from cancer in India according to the latest statistics, that is 2025, is 1.57 million cases. Okay, 1.57 million cases. Okay, that is 100.4 per 1 lakh population, or 1 in 9 person in India are suffering from different or various cancers. So 1.57 million cases according to the latest statistics, that is 2025. According to 2025, we have 1.57 million cases of cancer patients. Okay. Then regarding death rate or mortality rate, every year in India 13 lakh of people that is suffering from cancer may die due to different reasons. So the mortality statistics of the cancer patients in India, that is 13 lakh. So every year 13 lakh of cancer patients die from India. Okay. Then the general features include India contribute third, okay, of the total nations of the world. So India contribute third among the nations. So that is India contributed 7.8% of the total cancer patients in the world. Okay, that is 7.8% of the total patients of the cancer from India. Okay. So India is the third most contributors among the world, that India contribute nearly 7.8% of the total cancer patients in the world. Then moreover, one other general significance is 1 in 10 new cases detected in India as cancers, okay, comes in breast cancer. So there is another significant in India, the breast cancer are significantly rising. Okay, so 1 in 10 of all the cancer detected patients at present in India is suffering from breast cancer. Then last one is related to others. Okay, it includes accidents. Okay, on an average 1264 people dies per day due to different road traffic accident in India. Okay, that may varies. Okay, this statistics may varies from day to day, but on an average we have 1264 cases of RTA per day, and there are 462 deaths every day in India. Okay, so out of this 1264 accident cases, we have nearly 462 death from various road accidents every day in India. Then according to National Crime Records Bureau, NCRB, okay, National Crime Records Bureau, there is 1,50,000 deaths per year. So in India, nearly 1,50,000 deaths, okay, due to various road accidents occur per year according to NCRB report. So thanks for watching. So far we have discussed in detail and in depth about the various significance of non-communicable diseases prevalent in India as a part of the major health problems in India. Okay, I have already uploaded the general video of major health problems and a specific video of communicable disease problems in India. If you have not watched that, please go through that and you understand better about the major health problems, communicable disease problem, as it is one of the important topic in community health nursing for the exam purpose. Hope this video really benefits in your studies and exams. If you feel it is really worth and beneficial, please like, share and subscribe my channel and stay tuned with the Angel Health Academy for the next and important academic video. Thank you.